How does translingual neurostimulation compare to CPAP? If you are curious about how translingual neurostimulation stacks up against continuous positive airway pressure therapy for sleep apnea, you are in the right place. Let's break it down. Continuous positive airway pressure therapy, often called CPAP, is the traditional treatment for obstructive sleep apnea. It works by delivering a steady stream of air through a mask, keeping the airway open during sleep. While this method is effective, many people find it uncomfortable. Issues like mask fit, noise, and general discomfort can make it hard for users to stick with it. On the other hand, translingual neurostimulation uses a different approach. This treatment involves an implanted device that stimulates the hypoglossal nerve, which controls the tongue muscles. When activated, this stimulation causes the tongue to stiffen and move forward, preventing airway collapse. This means you do not need a mask or any external device on your face while sleeping. When it comes to effectiveness, CPAP is still considered the gold standard. It significantly reduces the apnea-hypopnea index, which measures the severity of sleep apnea, and improves oxygen levels during sleep. However, for those who cannot tolerate CPAP, translingual neurostimulation has shown promising results. Studies indicate that it can lead to about a 68% reduction in the apnea-hypopnea index. Many patients also report improvements in daytime sleepiness and overall quality of life. Patient selection is another key difference. CPAP can be used by most individuals with obstructive sleep apnea, but adherence is often a challenge due to discomfort. Translingual neurostimulation is generally recommended for those with moderate to severe obstructive sleep apnea who struggle with CPAP. Candidates typically need to meet specific criteria, such as having a body mass index under 32 and not exhibiting certain airway collapse patterns. The implantation of the hypoglossal nerve stimulation device is a surgical procedure. Once implanted, patients can control it with a remote, allowing them to adjust stimulation levels each night. After the surgery, patients usually undergo titration studies to ensure the therapy is optimized. Side effects vary between the two treatments. CPAP users often experience discomfort from the mask, nasal congestion, or skin irritation. In contrast, side effects from translingual neurostimulation may include temporary pain at the surgical site or tongue soreness. These issues typically improve over time, and serious complications are rare. From a practical standpoint, CPAP requires nightly use of a machine and mask, which can disrupt sleep for both the user and their partner. In contrast, translingual neurostimulation offers a mask-free solution. Patients activate the implanted device each night, which may lead to better compliance and improved quality of life for those who find CPAP challenging. In summary, while CPAP remains a highly effective treatment for obstructive sleep apnea, translingual neurostimulation presents a promising alternative for those unable to tolerate CPAP. With its unique approach and fewer external devices, it is an exciting option in the evolving landscape of sleep apnea treatments.